tumors. So the adipocyte tumors are broadly divided as benign tumors, intermediate tumors, and malignant tumors. The most common benign tumors are the lipomas, and the most common malignant type tumors are the liposarcoma. So, what is a lipoma? So, lipoma is a benign tumor composed of mature adipocytes or the mature fat cells. Most common benign soft tissue tumor. So, it is more seen in it is more seen in females than the males, and it can occur anywhere where fat present, and the peak ages are more to 40 to 60 years old people. So the most common sites where you find these lipoma, the subcutaneous tissues of the trunk, like back and shoulder, and then neck and proximal lips. And what is the etiology and the pathogenesis of lipomas? This is usually sporadic. Somehow some show the cytogenic abnormalities, and there are rearrangements or the mutations in the chromosome 12. Chromosome 12 or HMGA2 gene. So this is not associated with true obesity. So you have to remember this, that this is not associated with true obesity. It is related. And when talking about the gross features of a lipoma, look at these. So you can see there is a fibrous capsule and it is well circumscribed. Look at these places. As I said earlier, the most commonest places, shoulders and back. So head and in proximal limbs. So they are well circumscribed, and there is a fibrous capsule. And as I said in the earlier video, when talking about the gross features, you have to talk about the cut surfaces. So, in a cut surface of a lipoma, you can see a bright yellow color, uh, like normal fat. You can see it clearly in this image, and these are lobulated. These yellow color fat masses are lobulated. Uh, so the consistency, or if you touch this, you will feel soft and greasy. And there is a capsule. Look at this. There is a capsule. It is well encapsulated. So as this is a benign tumor, it should be encapsulated, and it is sharply demarcated. And those are the things that you see in a cut surface of a lipoma. And regarding the microscopic features of a lipoma, so you can see here in this picture very clearly, there are mature adipocytes and uniform cells with, you can see this peripheral nuclei in this picture. So it is not clear in this picture. So uniform cells with peripheral nuclei are there, and also thin fibrous capsule and no atypia. When regarding the clinical features, it is soft, mobile, and uh, painless swelling. So it is slowly growing, and usually it is less than 5 centimeters. So now we are going to talk about the malignant type of adipocyte tumor. It is the liposarcoma or the liposarcoma. The definition is liposarcoma is the malignant tumor of adipocytic differentiation. Uh, one of the most common soft tissues sarcoma in adults. So epidemiology, it is also in the people with age between 40 to 70 years old, and it is common in deep soft tissues, and males are most affected slightly than the females in the sarcoma. When talking about the most common sites where you find the liposarcoma are the deep soft tissues of the thigh and the retroperitoneum. That one thing you have to remember when talking about the sites is, if this liposarcoma occur in the retroperitoneum, it is very important to know until it become huge, we don't be able to detect it. So it will grow bigger when we are detecting it. And The gross features of liposarcoma, as you can see, they are poorly circumscribed. And when talking about the cut surfaces, you can see hemorrhages and necrosis areas, and also it is not uniform like an lipoma, and uh, the cut surface is like yellow, gray, white mix areas, and these red patches are hemorrhages. So you can see that it is not beautiful like the lipoma cut surface. When talking about the microscopic features, the most key diagnostic thing is the lipoblast in this slide, and the lipoblast like these things, and also you can see the nucleus. It is a scallop nucleus or indented nucleus, and you can see mitotic figures on this slide, like these things, and pleomorphism is also there. So these are most commonly the features of an malignant tissue. And the matrix is or the stroma is a myxoid stroma. So those are the things in a microscopic appearance of this tumor. So, when talking about the liposarcoma, there are four types of liposarcomas. They are the well differentiated ones and de-differentiated ones, myxoid ones, and pleomorphic ones. So, in this video, we are not going to talk about these things. Uh, uh, telling about the types. So, the clinical features are like uh, the lipoma was painless, and this is also painless, and this is an enlarging mass. And where does this occur? Deep in the deep locations, like in the thigh and retroperitoneum. So the presentation is very rare, and retroperitoneal tumors have these. And if there is a retroperitoneal tumor, so abdominal distension can occur. So the behavior of the liposarcoma is, as we already know, is a malignant, and a local recurrence is common, and it can have metastasis to the lungs by hematogenese, and it prognosis varies. The best prognosis is in the well differentiated tumors, and the worst prognosis is in the pleomorphic tumors. So those are the things that we have discussed about the adipocytic tumors, and next we are going to talk about the tumors of the smooth muscles.